So when a child with Down syndrome is born, the parents are devastated. They don't know how to handle it now because they have heard so much about a child with Down syndrome and managing it is so difficult. And with the advancements of medical science, I can say a lot more can be offered to such families. So I am Dr. Shambhavi Seth, a developmental pediatrician with Max Healthcare, to dispel such misconceptions. So Down syndrome is a genetic condition where in our body we have 23 pairs of chromosomes or 46 chromosomes. Extra chromosome is present in the 21st pair of chromosomes. So instead of 2 chromosomes, there are 3 chromosomes. That is why it is also called trisomy 21. So this is the most common form of Down syndrome. There may be other causes of Down syndrome. One of them is the mosaic form, where there may be an extra chromosome in few cells of the body but not all the cells. So essentially a mosaic Down syndrome would have a lesser clinical impact of the problem. And also the translocation, which is seen in 2.5 to 2% of cases, where the extra material of 21st chromosome may not be present as a whole chromosome separate, but may be distributed over the other chromosomes, most commonly in chromosome 14. So having said that, it's a genetic condition, but most often, in most of the cases, the parents would be having a normal chromosome and it's a de novo mutation or a linkage which is happening in the child where the trisomy happens. Why it happens, we really don't know. But there have been certain risk factors which have been associated, and one of them is the advanced maternal age. The risk of Down syndrome increases in a female if the age of the female while the pregnancy is more than 35 years of age. But lot of children with Down syndrome are also born to younger mothers. So it becomes very prudent to screen all the pregnant mothers all across all age groups for Down syndrome. So the Down syndrome can be diagnosed antenatally, and by that I mean when the mother got pregnant, we need to see all the pregnant mothers. So there are certain tests which can be done at the first trimester, which is in the first 12 weeks. Many of these tests can be done through ultrasound, where we measure the nuchal translucency. Then there are certain blood tests like HCG and PAP-A levels in the mother, which needs to be monitored. Few of the tests which we popularly know as triple screen or quadruple screen is done around 15 to 20 weeks of gestation, and these includes the tests like HCG, alpha fetoprotein, unconjugated estriol and inhibin. So these are the screening tests, where when we have a doubt in the screening test, we go for a confirmatory test which can be done through amniocentesis or CVS, which is the chorionic villus sampling. So there are certain newer tests which are now available, which measures the fetal blood in the maternal venous sample, and those are also very high sensitive tests which can be considered for the families if there is a doubt for Down syndrome. So when a child with Down syndrome is born, first we see the morphology, the facial features of the child. And if a lot of children with Down syndrome have distinct facial features, but it may not be present in 100% of the babies. And the common facial features can be a frontal bossing, a depressed nasal bridge, a small head size, and upward slant of the eyes. So if these features are seen, and along with that we also see other clinical features like a low muscle tone or hypotonia, which is very commonly seen in children with Down syndrome, we may either make a clinical diagnosis or do a confirmatory test through a chromosomal karyotyping of the peripheral blood of the baby, which is the proven diagnosis of Down syndrome. And after establishing the diagnosis, we may also have to do a variety of screen tests for other medical conditions which are very commonly associated. So for example, heart defects. A lot of children with Down syndrome, almost 40% of children would have a congenital heart defect, and they may have a thyroid problem or a hypothyroidism, which has to be looked for through another blood test like TSH and free T3 and T4. Then other systemic involvement, like children with Down syndrome are very vulnerable and they may have intellectual disability. Most of these children would fall into a mild range or a moderate range. Seldom very severe intellectual disability is noted, and along with that they may present with developmental delays. So it is essential to do a very periodic and close developmental monitoring of these children. We look for any visual problems. The children would be more susceptible to refractory errors and strabismus. There could be certain specific spots which may be seen in the iris of the eye. Then audiological evaluation or hearing evaluation. These children would be more prone for middle ear effusions, hearing loss. So first 6 months it is prudent and advised to do an audiological documented test so that we don't miss a hearing loss in such children. And apart from that, there can be gastric problems, gastrointestinal involvement. As the child grows, we may have to look for celiac disease in such children. And in later life, these children when they transform into adults, they may be more prone for other blood disorders like leukemias. In later ages, maybe Alzheimer's are more common in such patients. So there are a list of clinical investigations and monitoring which we need to do throughout the life for a person with Down syndrome, and it is not like one-time testing which is done and finished. So it is essential, the message is to monitor these periodical clinical monitoring is done along with certain specific testing, and also a clinical follow-up is mandatory for such patients. So when we talk about treatment of Down syndrome, it cannot be cured or the genetic defect cannot be reversed, but it can be managed at various levels to give a high quality of life to the patient. So a lot of thoughts are coming to a parent's mind when a child with Down syndrome is born, whether my child is going to a special school or a regular school, whether there can be an employment opportunity, whether the child can get married and pregnancy can happen in such couples. So all those things I would say would depend on the clinical spectrum of the problem. How much is the intellectual impairment for that child? What are the comorbid medical conditions? Is there are significant heart defects? A child or the patient is falling recurrently ill because of infections. So all those things would help to prognosticate the family. And having said that, we have a right to inclusive education in our school systems now, where a child who has a mild intellectual impairment can be easily be regularly schooled. They may require certain extra efforts or help in terms of special education or certain kind of therapies, but largely it is possible. Coming to employment, lot of non-government organizations and few government bodies are also working towards employment of these individuals, where they may be having a independent employment depending on the level of functioning, or they may also have a sheltered employment where someone is guiding them. So these opportunities have come up largely in last 10 or 20 years, and we should be aware about certain bodies which are working towards it. Coming to Down syndrome, having a baby. So a lot of females with Down syndrome may have difficulty in conceiving. They may be at risk for abortions, but the fertility does happen. With males, the incidence of infertility is more. But having said that, lot of times we need to evaluate a person in the marriage who has Down syndrome if they are planning for conception in detail, because we need to know the genetic makeup of that child and how much the child would be at risk for. So I hope with this information it was helpful for the families with Down syndrome who are dealing with this. And if you want to add further comments or ask us anything, please subscribe and comment below. Thank you.